Public Q&A presents Ask Reddit question. Doctors of Reddit, what was the most overdramatic or underdramatic patient you ever had? Overdramatic. Tons of stories, but the most recent was a patient demanding a heavy Percocet RX far more than I would prescribe even post-surgery after having a nasal swab for COVID-19 completed. I get that it's temporarily uncomfortable, as I have had it done several times myself, but no way was I buying him writhing around screeching about how much pain he was in. When the patient eventually realized I wasn't budging, it was as if someone had flipped a switch, and he miraculously recovered. Underdramatic. Patient tried extracting his own tooth, and inadvertently pushed it up through the abscess, and into his right maxillary sinus. To my surprise, he adamantly declined even local anesthesia, no matter how much my staff was pleading with him. Patient autonomy is a gray area here in the US given how insanely litigious everything is, so after receiving clearance, or written consent to proceed with treatment, I figured he'd just have to learn the hard way. Instead of performing a lateral window root tip retrieval, I took a surgical suction tip, or curette, and removed all 3 fragments, through the alveolar ridge, warning him several times beforehand that it would hurt like hell. The guy never even flinched. I was able to complete the procedure, debride the infection, and graft the floor of the sinus with membrane or sutures without incident. Go figure. And there's me, needing an injection to get my teeth cleaned. Wow. I don't have injections if I need a tooth filled. I find the injection worse. I don't know what to say apart from AARG. Farmers are notorious for being underdramatic. Had a farmer a while ago who was up a tree for some reason, and fell out. As bad luck would have it, someone had left a dirty meat hook at the bottom in the tree, and he landed on it, impaling his butt cheek. He proceeded to pull it out, finish what he was doing, drive himself home, and go to bed. The only reason he came to hospital was because his wife woke up to a bed full of blood, and insisted he get that looked at. Ah yes, the farmer modifier. When presenting a patient to a consultant or admitting doctor, one must lead at the top with the risk factor of being a farmer who actually came to the hospital. Especially if they're an older man. They seem to think they're bulletproof, and that if you ignore it long enough, it will get better on its own. OMG yes. MD here, did my family medicine rotation longitudinally at a rural clinic, and wow, the things I have seen: guy who duct taped his own ear back on and came to the clinic, guy who chainsawed between his toes and came to the clinic, guy who had one leg like 6 inches shorter than the other and was in his 80s but was going to get it fixed. 1-0 these days. I have been doing genealogy research lately and discovered that over 8 generations of my family, all farmers, the men survived wars and epidemics fine, but kept getting killed before the age of 40 by tipped tractors, infected cuts or punctures, or falling off roofs. The women all lived to their 90s. My farmer grandfather died from a tipped tractor in his 50s, when I was only a few months old. My amazing grandma kept the farm going into her 90s, then lived out her days in a nursing home. She died at 101. I was a medical assistant at the time. We had a farmer come in on Monday after having heartburn all weekend. Nope. Mild heart attacks for days straight. I love farmers. Did he get mad because it was raining, and they wouldn't let him go outside to roll up the window in his truck? If so, you've met my uncle. My dad is not a farmer, but he did this. Said he was short of breath for a couple weeks, and decided to get it checked out. He's a smoker, so he just thought it was normal. Nope, he was having heart attacks for weeks, had 2 in the doctor's office. And had 3 stents put in the same day. Oh gods, isn't this the truth? My friend had to go to emergency, and whilst he was sitting there, a farmer and his son came in. The farmer told the nurse that my son cut his arm, so the nurse asked where the cut was. My friend said the farmer held something up and said, "Here." The arm wasn't cut, it was cut off. My friend said the nurses freaked right out. My dad did that, except with his finger. My older sister, who was a toddler at the time, was holding his severed finger in a Ziploc bag and handed it to the nurse. He's a woodworker. When you're in a business with sharp tools, well, you become immune to certain surprises. Not a doctor myself, but my father once had a patient with stage 1 brain cancer come to him without knowing it. Apparently he crashed his car on the way to a friend's house, so he decided to come see why his head hurt so bad. The thought process of that guy though. I just crashed my car. May just as well walk. My head hurts a bit though, I should get it checked out. I once cared for a repeat self-harmer that put a knife into their neck, regretted it, taped it in place, and bicycled to the hospital. A few miles past carfuls of normal people. Parked the bike, walked into triage to check in. Through a waiting room of grannies and kids and men with chest pain. With a kitchen paring knife duct taped in place sticking straight out. CT scan later showed that the tip of the blade was 2 millimeters from the carotid artery. The truly insane part is, I pulled the knife out at bedside. Without surgery nearby. Never had I ever before done such a thing, and I hope to never do so. Rule 1 in penetrating trauma is to leave the object in place, as it may be the cork holding back the flood. Get imaging, assemble the team that will be needed for the repair, and then remove the object. But we were at a little community hospital, and this particular individual had a deep history of shenanigans, and there was a large chance that if I sent them to CT, they would deepen the wound or use the knife to hurt my staff. Presently, they were talking and breathing normally, and it seemed entirely possible the wound was superficial. I decided that if it had indeed penetrated the carotid, it could only be a puncture, and I could hold pressure on it more safely than leaving a knife blade with this particular patient. So with police flanking me, and my pulse throbbing in my ears, I yanked it out and passed it blindly to a tech behind me, every part of me focused on that neck. Did the patient ever get the help they needed? This was years ago. I have dug razor blades out of many parts of this person, admitted them to ICU for overdose a few times, handled blunt trauma and ligature injuries. They've spent well in excess of 2 years in locked wards, had all the meds, electroconvulsive and transcranial magnetic therapy. And they remain a troubled person. I have shifted to thinking of it like an end-stage cancer patient. I truly believe they will eventually complete their suicide because they have already had lots of every kind of treatment that I know of for their illness, and they remain sick. So it's palliative care. I focus on dignity and safety each day as it comes, instead of being invested in a cure. The day my demons eat too much of my mind and I turn into that, I hope the ER staff are as understanding as you. Thank you. Well, that just spiked my anxiety. Damn, that was close. I think we have all seen our share of overdramatic patients or heard the tales, so I'll go with the less common underdramatic patient. Patient presented to the trauma ER with an 18-inch machete blade firmly implanted across the top of his skull. He was driven to the hospital by a friend, possible assailant or owner of said machete, ambulated on his own into the ER, had totally normal vital signs in triage, a slight steady trickle of blood from the wound, denied pain, and was in no apparent distress. Due to a mass trauma event, the ER was insanely busy, so it took us a while to get him a bed. In the meantime, he calmly sat in the waiting area, nearest to the triage station, so we could keep an eye on him, and watch TV, as staff were running around like crazy, phones ringing non-stop, patients bitching about the wait time to be seen, and exhibiting other types of tomfoolery. Machete Man just sat there tranquilly exhibiting his true Zen mastery of machete head wounds. All these years later, I can still see him with that machete lodged in his skull. He had an uncomplicated treatment course and suffered no impairment from the injury. He was cooperative and nice to all his caregivers. He also profusely thanked us for caring for him. Probably one of the few that did that night. I can't imagine bitching about my wait time in the ER, when the man with a machete stuck in his head hasn't even been seen yet. ERs definitely bring out the darkness in people's souls. I don't think a machete to the head is going to impress folks that opt to check in late at night to an inner-city ER, especially the frequent flyers. You could literally be resuscitating an infant in the trauma bay, and the patient in the next bed will poke their head through the curtain and ask for a turkey sandwich. And believe me, the complaining will start a second later, when you fail to instantly produce said turkey sandwich out of thin air between chest compressions. When I was a teenager, my mum took me to the ER because I suffer from paroxysmal supraventricular tachycardia. I had a very strong outburst that day. It felt like 200 heartbeats per minute. Then we got to prove that it was. I was taken inside the ER in a wheelchair, and I started crying because the medication that I usually take for that wasn't working. I was rushed in to find a mother with a teenage boy around my age. He looked like he had broken an arm, and he was already getting treated, complaining to the doctors because he wasn't getting any attention for a long time. It got worse because the doctor rushed to see me instead of him. I just sat there crying in my wheelchair while the mother complained angrily to the doctor. Then, out of nowhere, the teenage boy, who had already noticed me with a worried expression on his face, got in the middle of the argument and yelled to the doctor, "For goodness sake, please help her first. Hurry up and help her." Next thing, I was rushed into a bed to get monitored and everything else, but I was so impressed by that boy's attitude. I wanted to thank him, but I wasn't even allowed to get up, and when I was finally out, he was already gone. I wish I could see him again to thank him for what he did that day. When I read stories about Karens who have kind children, I wonder how that happens. An adult in their lives that is a balancing influence. An innate sense of justice that eludes or is twisted in their Karen. A mix of both. As the daughter of a Karen, I think it's that you overdevelop empathy in an attempt to counteract your mother's lack of it. I have many childhood memories of trying to smooth things over and make a retail worker feel like a person again, while my mother was doing her darndest to convince them they were an uppity slave who deserved to be put in their place. I also had to often clean up her interpersonal messes with family and the few friends she could keep. The silver lining is that I have a sense of other people's distress and what they need to calm down that's through the fricking roof, and it's actually helped me a lot with conflict resolution. Yup, same. I knew that the way my mother was not the way I wanted to be because being around her exhausted me. I ended up latching onto any other mother figure that would have me. Aunts, grandma, my friends' moms. I learned how to recognize and control my emotions from them. My mom barely feels like my mother anymore. She's just someone that I occasionally manage when she causes family arguments. I was in a waiting room once because I sliced my arm open, but I had it well managed and wasn't too worried about the wait. Especially after a kid around 8 or so came in with blood pouring out his ear holding a blood-stained towel to it, and had to wait, too. Then some mid-40-year-old guy comes in on his own, and throws a massive fit over not being seen immediately. Sure, maybe it was critical, IDRK, but he literally stomped his feet while storming around and yelling, so he seemed pretty fine to chill for at least a few minutes to see how it went. He waited with the rest of us. Yup. I always point out to people, you never want to be the guy who is rushed to the front of the queue in any triage situation. The longer, more boring your wait, the luckier you are. Funny story, I walked into the ER on my own once. My dad drove me, was in my early 30s because he couldn't find a closed parking spot, so he just dropped me off about a block away. I was having an allergic reaction to an antibiotic. I was at work when it happened, took a bit to get off the phone with customers, but I popped a few Benadryl while I was finishing up my phone calls. When I walked in and told them what was happening, they took me to triage to get vitals and whisked me directly back. Didn't even finish getting my paperwork. This whole time I didn't feel great, but certainly not like I was dying. When the doctor got back there, he just kept repeating, "You're just so red. Are you sure you're feeling okay?" Apparently it was a bad anaphylactic reaction, and they had never seen someone in my condition conscious and in such good spirits. Recovered just fine. I'll never forget that doctor, though. I was like, yeah, I feel okay. A little under the weather, I suppose. Why should I be worried? Because it seems like you are. Those few Benadryl probably kept you alive. I am one of those people who should have had a bubble as a kid. My daily carry includes a big bottle of liquid Benadryl, and until recently an EpiPen. I am allergic to many things, some anaphylactically, and we always have liquid Benadryl around for emergencies. EpiPens too. Saved me a few times. You never want to be the number one priority in an ER, it means you're dying. I'll never forget the first time I had pneumonia. I parked my car and walked the 35 minutes from there to work feeling winded and uncomfortable. Make a joke to the guy making my coffee about, is this what pneumonia feels like? 4 hours later my boss gets out of a meeting and tells me that I am going there in a cab or an ambulance, but I will be going to the emergency room right now. I didn't even get to the triage desk, and they had a wheelchair waiting for me. Could hear me wheezing when I walked in. 6 nights in the cardiothoracic unit. Apparently they don't mess around with asthmatics that have pneumonia, and 2 weeks at home before I could walk and talk at the same time. I had a regular doctor's appointment for a follow-up after surgery. They took my B or P, and it was low. They took it again, low. They had me see the doctor and walk around a bit, low. That's when they really looked at me and saw I was sweaty and pale, exhausted and had a huge fever, and was flush. They called an ambulance, and the whole time, I am so sorry to waste your time. What a silly problem, I am sure I am fine. They got me to the ER, and I immediately saw a DR waiting for me at the door. And I am out of it, and naturally am kind of dumb even on my best days, so I say, oh wow, you don't need to see me right away, I really don't mind waiting. I am tired and can just take a nap. They freaked, and it turns out I was so sick that in a few hours I would have died. I had an abusive childhood, so I learned to turn my pain off and not bother anyone, and I just suffered through it. Didn't help that my now ex-husband kept telling me I was just being a dramatic woman. Now that I know, I would have been worried sick to be seen that fast. No bueno. I drove a friend to the ER several years ago after a concert went bad. He was being an idiot to security, and he was shoved to the ground and got some pretty gnarly facial lacerations which needed to be stitched up. The front admittance desk clerk apologized for making us wait for over an hour. Apparently there was a motorcycle accident, which was triaged as a higher priority, so getting a relatively minor wound cleaned and sewn up was pushed back. I would rather be bored in the waiting area than have an ER doctor take one look at my injuries and say, we need to get this patient prepped for surgery, stat. LOL, yeah, I have been that person. Not fun, but thankfully I don't remember any of it. So as for the story for this, I have migraines that mimic strokes and concussions and cause seizures, as well as other weird and scary medical anomalies. I was in high school, and it was nearing Christmas time, and my baby sister was in our church Christmas play. Now the play is a huge production at my church with 300 to 400 people showing up for multiple showings. There just happened to be flashing lights, and combined with all the noise I got a migraine, and I was too stubborn to leave my sister's play when I still could. My aunt and dad along with a few other adults finally noticed something was very wrong once lights came back, and I wasn't really responsive with classic stroke symptoms: droopy face, slurred speech. They also said my eyes and pupils were being weird, though I am not sure that's a stroke symptom, etc. My dad and aunt managed to thoughtfully get me in my dad's car and drive to the ER. Now once we were at the ER, I couldn't even talk yet alone walk on my own inside, and my dad was freaking out trying to get help. Thankfully a nice man outside and some doctors leaving stopped and helped him get me inside, but found there wasn't chairs up front to put me in. A cot was thankfully up front, and I was put in that instead as people looked me over. Now this is where my dad's story gets interesting, as again, I have no memory of any of this. I was lying on the bed and my dad went to go talk and check us in to get seen, when my dad said he saw me have a seizure before the nurse's eyes widened and they called for him as they ran with my bed screaming codes. My dad claims to this day it was the scariest moment of his life, when he had never seen doctors move that fast in his life, as nearly 7 people were in my room in seconds with a crash cart already to the side of me. Dr. House would have immediately noticed how kind he was and sent him off for a battery of tests, because people aren't nice. His team would break into the guy who used the machete's home, and found that the machete was kept in an unwashed bucket that previously held pesticides. The pesticides on the blade were driven past the blood-brain barrier, causing the part of his brain that gets angry to shut down. I have been binging House for the last couple weeks, and I have started questioning me everything in my life like this. I like to imagine that the guy was a stressed-out prick before the stabbing. The stabbing actually did cause an issue, but it made him nice and calm. Nah. I think the machete-wielding friend that did the dump and run at the ER door, alcohol, and the relentless heat and humidity of summertime in Little Havana are the major contributing factors to his injury. Little Havana. Thanks for not starting off by noting that this was in Florida. It really kept the surprise up. I thought I might have given it away by calling him Machete Man. I just wonder what other traumas was worse that a guy with a machete stuck in his head had to wait. A drive-by shooting of a family barbecue. Multiple victims with critical GSWs. I suddenly don't wonder. Thanks for doing what you do, M8. My stepson broke his leg on a jump while skiing. He put his skis back on and came down the mountain. He told his dad he had fallen pretty hard, but wasn't in much pain. The next day he said his leg was clicking when he walked. Sure enough, he had fractured both bones in the lower leg. "'Tis but a scratch. Fuck yeah, I am coming down this mountain. I don't care if my leg is broken." The guy, probably. My dad did something similar, falling while skiing. Was fine the rest of the day, woke up the next morning and went, that's not right, then woke me up and drove 10 hours home, to find out he broke 2 bones in his right foot, and had done some damage to his Achilles tendon. Drove home like it was nothing, and his only response when they told him that was, "Ugh, that means I need surgery, doesn't it?" Well, guess I am not working for a few weeks. And that was that. No idea how he wasn't showing his pain. 60-70-year-old lady arrives at trauma ER. She was being chased by a cow, running for her life, and fell off a fucking 2-meter cliff. She had several fractures, but only really complained about her leg, and tried to get up and walk away several times, telling us she was fine. Initially we thought she had some head trauma, and was completely disoriented, but it turns out she was just that stubborn. She was hospitalized for a while, and had a good recovery. I do wonder if the cow fell off the cliff as well, lol. Oh god, this reminds me of my grandmother. Last year, my family and I went on vacation to Alaska, and went on a few hikes. At this time, my grandma was having back trouble and couldn't walk very well, so we were taking it slow and easy. Eventually, we got to a part in the trail where there were several moose on one side, and we were all backing up slowly to make sure we didn't accidentally get in between a mother and her child or wren. After we had gotten away from the moose, we looked around, and Grandma was nowhere to be seen. Turns out, she had ran all the way back to the car like a half-mile away because she was so scared of the moose. Face with tears of joy, we were like, "We thought you had back trouble." And she's like, "Well, I feel fine now." So now whenever she complains about her back hurting, we joke that we just need to get a moose out in her backyard, and she'll be just fine. Face with tears of joy. She was 73 at the time, BTW. She heard Grandma got run over by a reindeer, and decided she wasn't taking any chances. Eventually, we got to a part in the trail where there were several moose. Sir or madam, I think you mean meese. Initially we thought she had some head trauma, and was completely disoriented, but it turns out she was just that stubborn. I see you guys met my mother. Chased by a cow. I wonder how she even got into this situation. I knew a lady with a very similar story. It's got to be the same person. It was always her plan to jump off the cliff if a cow chased her. She had many years to weigh her options. Her initial plan was to jump on the back of any cow that charged her. But jumping off the cliff seems like the more plausible option when the time came. I was in my last week of school as a rad tech student, and a patient came in through the ER for a series of X-rays. He claimed to have fallen down some stairs, and we basically had to X-ray both legs from the knee down. Reader, I have never met a bigger, whinier baby. He moaned and groaned and flinched at the lightest touch, refused to hold still, would not straighten his legs, complained about the table and X-ray cassette being too hard. There were no visible injuries aside from a few scrapes and nothing obvious on the X-rays. He was still convinced that he would never walk again, and had broken both legs irreparably. Funniest part was that we had a different patient come in on the same day with a similar complaint. He actually had fractures in both legs and feet, and was very calm and cooperative for the X-rays despite his injuries. My totally uninformed, shooting from the hip thinking is that the first patient's behavior might have been insurance-related. Possible, but I am fairly certain he was a drug dealer on Medi-Cal. He dropped a few phones on the table when we moved him back into a wheelchair. Fun times at that clinical site. We were doing paternity testing for an apparently extremely acrimonious case of your son impregnated my daughter. No, he didn't, your daughter sleeps with lots of other boys. Each side sent a lawyer to the appointment. Each lawyer had their phone out recording, and followed the blood and cheek swabs from collection, through the lab for DNA extraction, performing the test in our PCR room, and watching me analyze the data files, which is exactly as boring as it sounds. It's like, dude, we're the neutral third-party lab here. We have literally zero interest in the outcome of the case, you don't need to be so dramatic. All the chain of custody stuff is documented. We have a second observer signing off on sample IDs. We're not going to risk lose our license by accepting a bribe from either set of parents. So, what was the result? Don't you dare leave us hanging here. Ha ha ha. What was the result? Edit. Okay, since you want to know that badly, yes, he was the father. That's usually the outcome of paternity testing cases like this, since usually the girl has a pretty good idea before the test who she slept with. The whole Mamma Mia thing where someone does 3 guys in one night, or deliberately lies about the father right before being tested, isn't as common as talk shows and TV court dramas lead people to think. I'll have you know it wasn't the same night Donna slept with 3 guys in Mamma Mia. Yeah, it was over a week. And I always feel that Bill was the real father. Today I learned I really don't know the story of Mamma Mia. Your hotel on a Greek island is failing and your daughter is getting married, and has invited all of your ex-boyfriends, and told them each that he is her father. Now sing some Scandinavian pop music, and do some big dance numbers. Oh sweet child, come sit on my knee and I'll explain to you all about billable hours. I wanted to charge each lawyer a lab observer access fee, but my boss said no. They'd just pass that fee along to their clients. That's the point, the clients were obviously being unreasonable and overly dramatic, why not stick them with another bill? Travel to hospital 0. 6. Ensured proper chain of custody of DNA sample via videographic means 3. 2. Conversation with client resame 0. 1. Email to client resame 0. 1. Text message to client resame 0. 1. Receive text message from client resame 0. 1. Read text message from client resame 0. 1. Analyzed contents of text message from client resame 0. 1. Mentally formulated response to client resame 0. 1. Composed text message to client resame 0. 1. Edited and site check text message to client resame 0. 7. Nad my dad's story. Old guy that needed a pacemaker, worked a farm in Utah I think. He realized at some point that when he started having an episode, he could just grab the electric fence, and it would stop. So this badass just ran fencing everywhere he could on his property, and grabbed the fence if he had an issue. Been doing this for months if not years. Thanked my dad for putting in the device saying how he can finally get out to areas of his property that he couldn't run fence to. That's the most old man farmer solution I have ever heard. Probably insisted on being fully conscious for the pacemaker installation as well, since anesthetic might take a while to wear off, and that would mean the work isn't getting done. I feel like both of my grandpas would do this. Dad's good friend did shit like this until he died. Of the pain that he underreacted to, the highlights include: was shot 7 times in Korea on his first mission. He dragged himself around in the Korean wilderness throwing hand grenades with the good side of his body for 3 days in February before he was rescued. He was allergic to penicillin, so they thought he was going to die when one of the wounds became badly infected. He poured salt into the wound in the hospice ward daily. He survived. 2. He went over tea kettle over a horse's head out in the middle of nowhere. He came to and thankfully the horse hadn't bolted, so he rode home. He noticed his ribs were moving as he rode home. He taped them up. He noticed they were still moving 6 months later and finally went in for an X-ray. Had separated 7 ribs from his spine. 3. A classmate of mine was helping them brand. Something went awry while loading an improperly hitched horse trailer. The tongue popped off and landed on his hand with the full weight of the trailer. He calmly looked at my classmate and his companions and said, "Someone want to go get a jack?" That's the kind of man Romans envisioned when they wrote of demigods. Seemed like a solid unit. May he find peace now. The last one. Oh fuck bud. And the middle one, and the first one. Holy poop. This is my favorite so far. Jesus. I mean, that's a way to get through it with minimum fuss. But, good God. Nad. Young trauma patient 17 T-boned by a garbage truck. Moving him onto the CT table he said ow and silent tears came down his face. Then he apologized for complaining, and thanked us profusely. Turns out he had a few broken vertebrae, broke half his ribs, and had a fractured hip and clavicle. Kid whimpered a few times during the CTS, and again apologized when we came back in. Like dude, you could scream in my face and I would understand. I apologized to a doctor in ER once, for wasting their time, after it turned out that I wasn't having a heart attack. I got told in very direct terms that I am an idiot. For apologizing, not for showing up at ER with chest pain. I got called a fucking idiot for having a mild stroke TIA, and not going to the doctor until the next day after my symptoms went away. I actually don't disagree with the doctor. I just didn't know they can call you a fucking idiot. Something about those last 2 lines is making me laugh out loud. Like, hang on, can you say that? Come to think of it, I am not sure there's a rule that you can't say that. Seriously. Also, please go to the ER for the worst headache in your life. And my left or right side stopped moving. So I asked my former nurse friend, and she said to take Tylenol and go to sleep. Direct quote from a retired nurse who came in very late with a clear presentation of stroke. From their POV, it's better to be safe than sorry. You're better off slightly overreacting, coming in with complaints about chest pain, and getting an EKG, which shows that you aren't having a serious cardiac episode. The opposite is much more dangerous. You downplay chest pain, and damage your heart, or even die. Also, chest pain usually isn't normal, so you need to get that checked out regardless to mitigate whatever issue is causing it, even if it's not life-threatening. Absolutely. I hate going to the ER for myself because it feels like others have more serious things happening, and my issues can wait. Several years ago, I was coughing up blood and tried to downplay it first holidays with my then girlfriend, parents were in town, etc. I didn't want to ruin everyone's holidays by going to the ER and figured I could wait until after. Christmas morning my partner forced me to go, but I opted to go to urgent care instead. Walked up to the urgent care desk and promptly passed out. An ambulance ride to the ER later, and they told me I had a bleeding stomach ulcer, and they were surprised I hadn't already died from blood loss. If you have cause for concern, go to the ER. I had the same thing. My wife and I were in a car accident several months before, and I was having chest pains, so I went to the hospital. They did a test where they put a bunch of sensors on your chest and your ankles. The doctor looked at the results and said I had a really strong heart. Turns out, the accident caused a problem with my neck and was making the muscles in my chest contract. When I apologized for wasting their time, they told me they'd rather have me come in and make sure than have to send a coroner because I didn't want to bother them. You may have thought you heard me say I wanted a lot of morphine, but what I said was, "Give me all the morphine you have." Also, if you present with this kind of trauma, you usually get asked if you want something for the pain, no matter if you are complaining or not, which you'll get via for which takes like 20 seconds to get potent, and you're kind of stupid to pretend you're not in pain. With multiple fractures I would be like, yes, hit me up with everything you got. Adrenaline and shock are interesting though. Got hit by a car. It was 3 days later I realized what happened. Well, after being at the hospital. Might be from the brain injury though. I always get whatever drugs the hospital can give me, cause I am never having a good time if I am in the hospital, so I try to make the best of it. I had bone surgery on my foot many years, and will never forget the moment they pushed fentanyl into my fore. I immediately wondered what else I could get operated on. Honestly, I would take that as a sign of something bigger as well. People who apologize for something innocuous usually have a reason for doing it, and it's usually not a good one, like they think it's wrong for them to voice a complaint, or say they are hurting or uncomfortable. Makes me sad. My adopted daughter had a pretty shit first 5 years. Her experience of pain was bizarre and unpredictable. Break your arm. Take a nap. Appendicitis. Have to be told to stop jumping on the bed at the hospital. Need a sliver removed. Fight like the hounds of hell are after you. The good news is that my husband and I were separated from her and each other at the ER multiple times, so they could question us separately to assess for safety in our home. They pretty consistently recognized her pain tolerance was a sign of abuse. That gives me hope for others to be protected. Edit. She was also at the ER all the dang time because she had zero sense of danger or self-preservation. This makes me feel better. Not that your daughter had to go through a lot of pain, but the fact that doctors tried to follow up and make sure kids were safe. I have never been admitted to the hospital or had the police come, but I have always wondered if anything would have even changed if it did, because all the other times adults knew about it, nothing happened. I think the biggest shock I had was when DHR came to get our responses after a concerning email was sent through my school email, and the lady quit her job without putting any of our info into the database. Instead of the patient, I find it's always the family that's the most dramatic. I think it makes sense. When you are injured or sick, you know exactly how you feel. When a loved one is hurt or sick, you aren't really sure how bad is it and start panicking, thinking it worse than it is. The worst is during a longer stay at the hospital and your family members clearly don't want to be there, but they insist that they want to be there for you. Meanwhile, being alone would be less stressful and annoying. Yes. I had an overnight stay and my dad-favored parent went home and left me in peace and came back the next morning with a change of clothes. Mom, we don't get along, insisted she stay the night. I didn't sleep at all because I was so stressed she was there. Not what's good for a patient. It's also difficult to feel protective of the person you love, and not be able to do a damn thing. One time my husband was rushed into emergency surgery in the middle of the night, and I just completely dissociated from myself in the waiting room. It's overwhelming to be so worried, and the only thing you can do is wait. These days I get a family daily who say, "We will cooperate with anything you need to do in hospital to help our loved one." 5 minutes later, why can't we be discharged? FML. Not a patient but a family. Third year of my residency in emergency medicine, we get to lead the trauma bay with extremely immediate supervision, of course. Since we advance ranks in July, my first shift happened to fall on July 4th, a holiday well known in EDS everywhere for being a special mix of booze and fireworks. We got an alert that EMS was bringing a coding gunshot patient. Now, if a patient with penetrating trauma loses pulse before the hospital, the odds are dire, but it later turned out this patient had no vitals even on EMS arrival. They realistically died before the ambulance arrived, but the commotion on scene was such that EMS decided to extract and transport rather than call it on scene. Patient arrives, clearly already having bled out. We went through the usual motions looking for anything fixable, and I called the code. Then, I went to the family room to break the news. This is a skill that is carefully taught. Assemble the family. Sit down. Make introductions. Find out what they know. Get a sense for how they speak, so you can match them. Be empathetic but also very concrete. Answer questions. I had a grouping of 3 or 4 family members and I did all the things and it went okay. Then, over the next 15 minutes, another 20 family member trickled in, festooned in red, white and blue, largely quite intoxicated, and they yelled the news to each other out of my control. And as each one joined the room it got wilder. People not only cried but they screamed. Soon, an auntie was vomiting in the corner. 2 small kids were ignored, wide-eyed off to one side. A grown-ass adult man actually lay on the floor and kicked himself around in circles like Homer Simpson. I have never seen anything else like it before or since. Oh my goodness. I feel bad for the family and for you for having to deal with this obviously, but the Homer Simpson comment made me laugh so much. I am going to hell. A grown-ass adult man actually lay on the floor and kicked himself around in circles like Homer Simpson. I would never be able to keep a straight face, and the family would probably lynch me. There was a guy who attempted suicide by firing a nail gun into his ear. I took care of him in the ICU, and he remembers everything. Had been depressed a long time, and decided to end it. Nailed himself, sat around a while before deciding he didn't want to die, drove himself to the ER, walked inside and fainted. It was so weird how stoic he was about it all. I am imagining it almost played out like this. Dude. I want to die, shoots self in head with nail. Body. Well, here I am not doing it. Dude. Guess I am living, then. Better get this nail taken care of. A lot of more common suicide attempts tend to be things that you can't back out of. I think the fear or disdain for death is still embedded in people that try it, which is why people jump off buildings. They just have to commit to the jump, and if they have regrets, they can't turn back. I remember watching a documentary on bridge jumpers. It may have been specifically about the Golden Gate Bridge in SF. They interviewed survivors and almost every one of them said they regretted their decision as soon as they jumped, and that whatever problems they were having seemed trivial now that their fate was sealed. Suicidal people often don't want to die. They just want the pain to stop and they can't see any other option in the moment. The weak breeze whispers nothing. The water screams sublime. His feet shift, teeter-totter. Deep breath, stand back, it's time. Toes untouch the overpass. Soon he's water-bound. Eyes locked shut but peek to see the view from halfway down. A little wind, a summer sun. A river rich and regal. A flood of fond endorphins. Brings a calm that knows no equal. You're flying now. You see things much more clear than from the ground. It's all okay, or it would be. Were you not now halfway down? Thrashed to break from gravity. What now could slow the drop? All I'd give for toes to touch the safety back at top. But this is it, the deed is done. Silence drowns the sound. Before I leaped I should have seen the view from halfway down. I really should have thought about the view from halfway down. I wish I could have known about the view from halfway down. It's usually how it's played in those cases, tbh. It can be frustrating, but in the end, well, life-saving. If he was so depressed, it makes sense to me he was stoic. Not as much concern about bad outcomes as an average patient, I imagine. I am not depressed but went through multiple traumas, was diagnosed with PTSD, but no longer now, and often get comments on how resilient, patient and chipper I am. In most cases that was my emotions being dulled and going on autopilot, because there was this screaming vortex of terror taking up most of my energy. I am a nurse, and we had a patient recently who was palliative, expected to die naturally. His body functions were only at about 10%, he wasn't eating or drinking, and he wasn't peeing or defecating anymore. He just laid in bed with his eyes closed, breathing. When people get to this point, usually the only care we provide is for comfort versus sparing life. So we don't give people food or water because they are usually unconscious and more likely to choke and be harmed. This patient's daughter was some big shot lawyer from the US, and when she saw that we weren't feeding her dad, she started recording everything we did, and said to her, and then phoned the police. I remember a police officer coming to the unit, asking to speak to me, the most responsible nurse at the time, and asking me why I was withholding food. I explained to the officer that I had physician's orders to withhold food, and that the patient was at a severe aspiration risk. The police officer was like, cool, case closed, and left. The daughter was unfortunately banned from the hospital premises by management for interfering with patient care. Wish this wasn't such a common issue with grieving families. I have had people sneaking their own thermometers in to do OBS on their poor grandfather, who was in his last days of life. The patient was the only one who understood he was dying. The denial and anger phases of grief are a nightmare to deal with. That same family cornered me in a room and accused me of putting the idea into the patient's head. The misunderstandings around food and water are so common too. Most people are so removed from dealing with death that they really just can't grasp what is happening when they see it for the first time. Not my story, but a coworker's. Said she cared for a patient that works in a circus. They did a similar act where the guy shoots an arrow to get the apple off her head. Well, it went in through her neck. She said she came to the ICU calm as a cucumber, and was talking and answering questions appropriately with a fucking arrow impaled in her neck. Overdramatic. I couldn't even begin to describe this. The percentage of the population who cannot cope with life is ridiculously high. I regularly see young adults hysterically crying because they have a cold or some small injury. Sure, I get it hurts and you don't feel great, but come on. Underdramatic. The one that stands out was on an OB or GYN rotation when I was in school. This stoic Eastern European lady went into labor while she was at work earlier in the day. Apparently she never called her husband to tell him. So there she is, about to start pushing, and her husband calls her. She just says, I am having the baby. Then there is some pause where he says something. She replies, no, you stay there with other child's name. I'll be home tomorrow. Then she hung up and pushed out a baby. Supposedly, my mom was similar with my younger brother. Kid 4 will do that, I guess. Raises the question of how grandma handled kids 5 through 11. Not doctor but EMT. Had my fair share of overdramatics, though I would say most of them suffered from some sort of mental impairment or dementia. Most were manageable, but I do remember this one woman that we had to take to dialysis on a regular basis. It was always hell from the moment we walked into her nursing home room. "Who are you? What are you doing to me? Help, I am being kidnapped. They are going to rape me," etc. I am pretty patient. The first maybe 5 or so times we ran her, we were very slow and gentle with her. I would explain multiple times to her who we were, what we were doing, showed her our IDs and so on. But the screaming and yelling and flailing would continue. One day we picked her up from the dialysis center, and they told us that she was absolutely not welcome back unless the nursing home started highly medicating her. See, not everyone that goes to dialysis is old and feeble. A lot of younger folks come in on their own power. And they told us that nearly a dozen clients had stopped coming in and switched centers due to her outbursts. In the USA, healthcare is a business. Most underdramatic was the gentleman that we were taking from an ER to a specialty trauma center. He had been in a bar and witnessed a bar fight. He tried to break it up. One of the guys smashed a beer bottle over his head. Spoiler: it's not like on TV. The beer bottle was hard enough to break his skull, but it also broke the beer bottle. The way the impact hit it partially popped his eyeball out of the socket. Then the broken beer bottle traveled down his face and sliced the eyeball in half. Very few injuries bothered me that I saw as an EMT, but the second I saw his face my eyes just started watering. But he was the calmest, most polite Mexican gentleman. Only spoke a little English, but everything was "Si senor" or something of equal politeness. Didn't utter a single complaint. Okay, that is probably the worst thing I have read in a long time. That's like a Stephen King fight. Holy fucking shit, the guy who tried to break up the bar fight. How do you even go about treating that? I don't know, but after examining him, I would be very surprised if he kept his eye, or if he did, if he could even see out of it. I am sure. I don't have any medical background, but literally thinking about trying to fix that makes my head spin. Like, do you put the eye back? Can you put it back together? With what? What happened to the nerves? So many questions. Not always the end of the eyeball. My grandma had her eye torn partly out by rusty barbed wire. All the humor inside leaked out, and the eyeball deflated in the socket. 10 or 10 for gross. It eventually healed, and filled back up with fluid. Her vision in that I was kind of bad, but she had shapes and colors enough to maintain depth perception. I hope he is okay now. Not like on TV. If they ever show that on TV, I am not watching. Edit. A word. Told this story before, but it still shocks me. Nad, but my friend tended to a very underdramatic patient during her nursing placement. The doctor was talking to the patient while my friend was inserting in 4. Then without warning he projectile vomits all over the place and onto the doctor and my friend. The following conversation ensues. Doc. Are you all right? Man. Yes, sorry about that, it happens sometimes. Doc. How often? Man. A few times a day. Doc. How long has this been happening? Man. Oh, for the last 3 years, I think. My friend didn't see that patient after that, so we never really found out what it was. It was so long ago that I can't even remember what she said he was in for, but I know it was for something completely different. I had a patient who would often have a syncopal event when she had to poop. Unfortunately, she never bothered to tell us, so one day she just gets up to go to the bathroom and collapses on the floor unconscious. Of course we call a code. She comes to after a few minutes and says, "Oh, sorry, that always happens." I worked in hospitals for 14 years, and a nurse I worked with one time told me of a patient admitted for something completely unrelated had a fainting episode one day when she was getting out of bed. She came around almost immediately and without assistance, and was a bit embarrassed. She apologized and said it happens all the time if I get out of bed too fast. Fortunately, this nurse wasn't taking that as an excuse and called for a neurological assessment. Neuro found nothing but called cardio. Together they discovered she had POTS, postural orthostatic tachycardia syndrome. I don't need sleep, I need answers. Happened to me, took 4 years of tests to be diagnosed with Crohn's disease. Absolutely normal disease, but my symptoms were slightly different. As a med student, I was third row in helping to try to code a drying GI bleeder. People who have end-stage liver disease don't make clotting factor well, and also have anatomical difficulty that leads to big, ropey vulnerable blood vessels in the stomach that are at risk to bleed. And when people bleed inside the stomach, you can't hold pressure, you simply must get them stable enough to have life-saving endoscopy and clipping of the bleeder. This guy was exorcist-level vomiting bright red blood, he was exsanguinating into his stomach, and we couldn't get his blood pressure to stabilize enough to get a scope into him for a while. There were runners bringing us coolers of emergency release blood, and the splatters and pools of blood he had vomited reached across the hall. When we finally got him packed up to go to the endo suite, the family next door quietly apologized for taking our time for their chronic non-emergent issue, and could they go home now? Did he survive? He made it to endo, but I don't know beyond that. One hard part of being in the ed is that you have to work to get follow-up. Guy I did construction with accidentally hit himself in the lower abdomen with a nail gun. Had fluid leaking out from around the nail. He takes it out and even more starts coming out. Was pretty sure it was pee. Went to the hospital, very calmly holding his finger over the hole. Told them he thought he might have punctured his bladder or something. The nurse said that wasn't very likely, so he took the finger off to show her the fluid leaking out. Once again, a solid stream of what was most likely actually urine came pouring out. Much like he was peeing through a hole in his abdomen. She fainted. They had to do some minor surgery to close the hole. I would imagine he's someone's underdramatic patient story. My doula said the pregnant ladies that come screaming into the maternity ward the baby is coming, now fall into 2 categories. One, they are dilated to 1 to 2 centimeters, and are hours to days away. Or they are minutes away from birth, and they have the baby within 10 to 15 minutes tops. The last lady like this was the day before I came to give birth, and she didn't make it to the elevators from the parking garage. I was told a story by my midwife about a woman who had come in and given birth in the reception. On being taken up to the ward afterwards, the midwife was trying to be comforting and told her that sometimes it happens, that a few years previously a woman had given birth in the car park. The new mom looked down at her baby and up at the midwife and said, "Yeah, that was me, least this time she made it into the building." Haha, this is brilliant. I went from 3 to 10 centimeters in 15 minutes on my first and 10 minutes on my second. There's no telling how fast a woman can dilate. Not disputing that some women experience severe pain and genuinely think the baby is coming at a couple cms. Labor is no crack, really. That's how my cousin was born, in a residency hall at a university. My aunt thought, my labor is starting, I'll get my stuff and walk to the front of the building to wait for my husband. And she only made it down the hall, and then there was my cousin's head peeking out. She was totally traumatized. According to my mom, it was 8 minutes between the time she checked into the hospital and the time I was born. Must have been fun. People like that are the reason why no one believed me when I showed up at L&D and told them my water broke. Oh, like your pad is wet. Like I peed myself. I said, well, my socks are getting wet, so you tell me. The nurse in L&D argued with me for ages when I told her my water broke. I was a first-time mom. I was 2 weeks from my due date, and even though my water had broken about 2 hours prior to me getting to the hospital, I wasn't having any contractions. No way my water had broken. I would definitely just peed myself. Nope. I was wearing a literal diaper. It was the only way I could move without leaking everywhere. So gross, I know. When she finally got around to checking me, with that smug "I get to tell you I told you so" in a second look on her face, she was absolutely shocked to discover I hadn't peed myself. When I was being born, my mum kept yelling at the nurses that the baby was coming. None believed her but checked just to ease her mind. I was born just a few minutes later, lol. My niece was born like this. My sil begged the nurse to check, and when she finally did, to ease her hysteria, she put her fingers in my niece's mouth. Suddenly the baby is coming. Nad, but I work as a PA in the ER. Farmer came in for bilateral hand injuries by private vehicle. Hands were wrapped in towels. Calmly told us that he was helping birth a calf by wrapping twine around the protruding legs and pulling. Mommy cow decided to take off, and the twine became tangled around his hands. He is covered in manure because the cow dragged him a bit face down. Unwrapped his hands, and he still has the twine embedded to the bone in 3 of his fingers. We unwrapped the twine and there was nothing but bone still intact underneath. Still completely chill. Started on 4 antibiotics and began to wash the wounds. This was the point where I called a hand surgeon and transferred him. One of the tensest staff situations I have had. We had a Jane Doe trauma code, a pedestrian hit by car. Polytrauma with clearly non-survivable injuries to the head and neck obscuring her features, but as we cut her clothes off, the nurses exclaimed it's. Recognized her jewelry. She was one of our frequent flyers, a lady with severe schizoaffective disorder and chronic depression whom we all knew very well. By EMS report, she had jumped out into a state highway in front of a car, wearing dark clothing at night. It's hard feeling like we were in a sense her only family. We were gentle with her, and genuinely grieved. And then EMS brings us a patient having a panic attack. He had been driving on a local state highway at night, when someone jumped out in front of his car, and he was terribly afraid the person was badly hurt. I don't work in a large place. There were some delicate logistics involved in keeping her body, and the state police photoing her away from him. I used to work in a SNF. We had a 49-year-old male admitted after a drunk driver hit his car headfirst after running a red light at 3 p.m. on a weekday. Guy had 2 tib or fib FX plus 1 or both of his bones in his arm, not sure on the deets. So he was there because he had a cast on 3 limbs. Super nice guy, and we became buddies. This coincided with the new season of Game of Thrones, which he was missing because we didn't have pay channels. I brought in my TiVo where I would recorded the first 5 episodes and hooked it up to his TV so he could catch up. Anyway, I digress. I found out towards the end of his stay that the drunk driver was in worse shape than he was, and someone at the hospital had had the bright idea of putting them in the same shared room. The bonus is his wife isn't right now at that hospital. So I feel like that hospital just gave their entire family an employee the bird. Not a doctor was in a mobile aid station, and one of our guys caught a bullet in the ass during a live fire exercise. He just laid there calmly as we got vitals to hand him off to the ambulance. The only thing he requested was a blanket because he was cold, and all the officers were shitting themselves because someone got shot during training at night. I was shitting myself because I was on radio guard when it happened, and my NCO was going to fuck me up because he thought I was asleep. They admitted to not calling to let us know. Did he get really good at ping pong while recovering? Undramatic patient here. I stepped down wrong on a stair and rolled my ankle. Or so I thought. I was 22 and in good shape and figured after a few days it would be fine. Apparently had a small break in the bone on the outside of my ankle that was grinding together as I started walking on it. It was uncomfortable, but I could walk around on it, so I figured it was fine, just a slow healing sprain. One day, a week or so later I stepped down, and all of the sudden it hear this terrible crunching noise. Apparently the small break had continued to slowly get worse, and the bone basically slid over and completely severed the tendon. It rolled up into my calf like Kurt Schilling, and the crunching sound was my bone just grinding into a total mess of a very bad fracture. Since this has been going on for a few weeks, I don't go to the hospital. I call and make an appointment with the orthopedic doctor for x-rays. Will never forget the tech's face. They wouldn't even do the x-ray, and went for the nurse who went for the doctor who immediately scheduled me for surgery. They could not believe I was walking on it. I still maintain it hurt less than a broken toe up until everything turned really bad. I just figured it would heal. Anyway, they had to reassemble my ankle, and then drill holes in my leg bone to tie my tendon back into place. And it was my right ankle, so I couldn't drive for ages. Total nightmare. Just always get x-rays. So weird that I cannot make myself read your post. I hurt my ankles frequently as a young teen, doing nothing more than going about my daily life. When I read about your injury, my eyes close, and I start shaking my head back and forth, my teeth get set on edge, and I feel the pain in my own ankles. So sorry. That's how I am with dental stuff. Had two co-workers talking about a root canal, and one said exposed nerve, and I had to put my head down so I didn't pass out. American located. Yes. My bad insurance definitely contributed to my reluctance to go to a hospital. This was back before you could stay on your parents' insurance until you were 26. I got bumped off as soon as I graduated college. On the bright side, no one could deem this busted leg a non-emergency, so it was covered pretty well. Oh God, this could have been me. One time I was driving down the road and some shit flew in my eye, not literal shit. Well, I figured it would work itself out. I went to the doctor's when it didn't a couple days later. He said no problem, I can get that out. He proceeded to give me what I can only describe as cocaine eye drops and proceeded to dig out the shit with a fucking needle. Now, I don't know if any of you have ever gotten anything dug out of your eye before, but you can't close your eye and you have to watch this needle come at your eye until it disappears, and is nothing more than a ghost moving around in the jelly of your eye. This whole time I am freaking the fuck out, cussing, being very vocal about the entire experience. Then, he hits the object, and the way your brain registers that vibration in your eye, it sounds like metal hitting on a rock when he makes contact, a high pining noise every time. The whole experience was entirely fucked up. 0 or 10, wouldn't do again. Nope. I can handle gore, nasty injuries, infections, whatever. But trauma is a hard fucking limit for me. I am not a doctor, but I feel this story fits. When my mom went to have my sister, she went into a room, the doctor came in. When he looked to see how the baby was doing, he said, "Ma'am, do you know you're in labor?" My mom said, "She's just stretching." The doctor replied with, "You're in labor as bad as the woman across the hall." Where the woman across the hall like? He went quiet, and you could very faintly hear screaming from across the hall. My cousin thought she was having Braxton Hicks contractions. Called the hospital because her son was but breech. They urged her to come in, but she kept saying no, it's just Braxton Hicks contractions. Her talking at 5:30 am woke her husband, who overheard her side of the conversation. He packed up all their stuff and called the neighbors to watch their older son, while my cousin continued to argue that she wasn't in labor. Then her husband grabbed the phone out of her hand and told the nurse they were on their way, and they piled into the car. When my cousin stepped out of the car at the end, her water broke. She literally stood up out of HT car, and her water broke. And some poor teenage boy saw it happen, and she said his face blanched. Sorry, man, that was gross. She waddled into the ed, and they start prepping her. Her husband parked the car. The OB was paged. The right now checked her dilation and discovered the baby's umbilicus was prolapsed. And then suddenly my cousin had another woman's hand inside her vagina, unkinking the cord and saving her son's life. With her other hand, the nurse called the charge nurse and asked where the OB was. The charge nurse replied that the OB was walking over from a far building and was going to be there in about 10 minutes. At this point, the husband walked into the delivery room, just in time to hear the nurse yell into the phone regarding the OB, then she needs to fucking run. Within 5 minutes she was on the table undergoing an emergency C-section. The kid was but breech, after all, and had a prolapsed umbilical cord. So anyway, that's how my underdramatic cousin almost died in childbirth 4 years ago. Edit. I have to clarify that her first pregnancy was hard on her, and they had to induce her. Pitocin is the drug they use for that, and it makes for very powerful contractions. More powerful than normal. So when she went into labor with her second son, she was comparing her current contractions to the Pitocin contractions from years earlier. Essentially, she had bad data, and was making a bad decision bad on that bad data. Obligatory, not a doctor, but having worked in registration in ERS for 5 years, I have some stories. Most overdramatic was a teenage girl whose mom and boyfriend would bring her in at least once a week. The boyfriend would literally carry this girl in, cradled in his arms, the girl limp and unconscious. And the mother would fuss that her daughter needed to be seen immediately. I tried to put on my best customer service face, but this woman was nuts. There was never anything wrong with the daughter, not my diagnosis, but verified with the folks in back who had medical degrees. I wouldn't put up with mom's shit, her yelling at me and demanding to be seen immediately. I never held back their info or anything, but I calmly explained to her that the emergency room was not first come first serve, that we triage everyone and treat based on emergent status, and the nurses and doctors would see her daughter as soon as they were able. The woman began calling after every visit to complain about my poor attitude. I insisted that I was calm and professional, and that my boss should ask the other people on staff if I had done or said anything inappropriate, which of course she didn't. My boss finally got the hint when once again the mom called in and complained, so my boss caught me to ream me once again as soon as I sat down to begin my shift. I found this odd because I actually hadn't seen them in a couple weeks. I had seen this family so many times, I had their info memorized, so I looked up the daughter's medical record number and politely informed my boss that their most recent visit was on a day I didn't work, so there is no possible way I had given them an attitude. She finally got off my back about it after that. The most underdramatic were about once a month, we would have an elderly person walk in, not the same one every month, and ask to be seen for cardiac symptoms such as chest pain, shortness of breath, arm pain, back pain, etc. These folks would drive themselves down a treacherous canyon from their little podunk town to us, as the hospital I worked at specialized in heart treatments, even though they had a small hospital up in their little mountain town area. It's an hour or better drive down a winding highway, a single narrow lane in each direction, surrounded by steep rocky cliffs on one side, and a dizzying fall into a notorious killer river on the other. Upon triage, the patient would be found to be having an active cardiac event, and would be asked why they didn't call 911. The answer was always the same: they couldn't afford the ambulance ride because Medicare didn't cover it all, and they were living off Social Security. Thinking about those patients still scares me after more than a decade since I worked there. Suicidal drunk fella, at a bar, jumped up onto the bar and slashed both his wrists deeply with a Bowie knife. He got swarmed by the crowd, tourniquet and brought to us. Vitals okay, and with trauma and hand in attendance we cautiously let the tourniquets down. The anatomy was pretty cool, you could see all the flexor tendons of fingers completely transected. Not much in the way of bleeding. Close it loosely and we'll do a proper or repair tomorrow, hand tells us, and leaves. Mammals have two sorts of blood vessels. There are the veins, which are thin-walled and compressible and carry blood from the extremities toward the heart. And there are the arteries, which have smooth muscle cells in their walls in order to handle the pressure of the heart beating blood into them, toward the extremities. This fella taught me a thing. So there's this creepy life-saving thing that arteries do. If a patient is bleeding out and gets hypotensive, the smooth muscle in the wall of the artery can spasm down and stop the bleeding temporarily. And the radial artery, spasm down, looked goddamned exactly like a flexor tendon to the entire surgical team. So they left him with me. And 15 minutes later, once everyone had left the room to make calls and enter orders on his behalf, this last-ditch survival thing relaxed, and he quietly, drunkenly filled the floor of his room with blood. And then we fixed it. Emergency docs are better at things the more sick people are, so once he was actively bleeding, everything was obvious. Point pressure, ask the tech for a tourniquet, get hand to come back and take them to the OR to repair tonight instead of tomorrow. It's only when people are looking middlingly well that we get bamboozled like that. And psych ward after that, obviously. I think I was the underdramatic patient. I was 12 and had cramps and was throwing up because of the pain, but I didn't feel like it was very concerning because I was on my period, so it was normal to me. My mom, however, didn't trust it and made an appointment with our GP, who immediately sent me to our local hospital because she was concerned. We didn't have a car, so my mom and I cycled half an hour to get there. The GP had called ahead, so they were waiting for me with a wheelchair, which I tried to refuse. The pain was in my stomach, there was nothing wrong with my legs, and I could walk perfectly fine, thank you. Doctors didn't buy it, and I had to sit in the wheelchair though. During and after tests, I talked to the doctor helping me. He didn't believe I cycled to the hospital until my mom confirmed it. He said he'd seen grown men twice my size come in with infection levels half of mine, and be unable to move because of the pain. Tests come back. Acute appendicitis. Got emergency surgery to remove the offending organ pretty much immediately. Same evening I am asking whether I could go home yet, as I was very bored. Was let go the next day 2 hours earlier than officially allowed because I kept asking. The next day I was back at school, and 2 days later I was back to running and jumping without a care in the world. Couple weeks later I had to come back for a final inspection or checkup, and was told that, if I would been as little as 2 hours later, the infection likely would have killed me. Doctor called me I was the toughest patient he'd had, though that might been an exaggeration BC, you know, tiny 12-year-old girl. Edit. Forgot to mention that during that last checkup, he also revealed that they somehow checked the appendix after it was removed, and I would had multiple infections before this critical one. They just always kind of coincided with my period, so I never noticed anything was seriously wrong. Sadly, the periods are still painful. Not patient but a doctor. I got a really weird allergic reaction a couple years ago, to the point all my skin started peeling off like from sunburns. I got an appointment with this supposed great dermatologist, and as DHE looked through my test results, she had the nerve to say everything is perfectly fine, after which I shake my head, and cover his desk with skin pieces, lol. Went from calm to freaking out in less than a section. Okay, now I have to know what happened. I assume you found out what you had. LOL, never got even HIV tests thinking on some weird autoimmune response, also full allergic panels, X-rays, CAT scan, final verdict, somatic origin. Always treat the patient, not the chart. Wow. You are still with us. Thanks for being such a nice person. As long as you are here, why not like this video and subscribe to our channel? Also, you can press the bell icon, so you won't miss any future uploads.